represents Oshkosh. My name's Senator Dan Feyen. I represent the 18th Senate District, which includes all the city of Oshkosh, includes town of Oshkosh to the north, and goes all the way over to Omro, all the way down to Waupun, and then swings up the east side of the lake, all the way up to Lake Johnsburg, to the Fond du Lac Calumet County line. And includes all the city of Fond du Lac, about 178,000 people roughly. This is my start of my third year. I got elected in 2016. Before that, I spent 29 years in the printing business. So happy to be here this evening to hear your thoughts on the state budget, and I'll turn it over to Gordon to introduce himself as well.
Thank you, Dan. I'm Gordon Hintz, represent Oshkosh. Really happy to be here. Want to really turn it over to all of you. I hope everybody signed in. Or do we do a sign in? Yep. Great. That way we can follow up on questions that we don't have. It's an important time right now. The budget was introduced right at the end of February. There are hearings going around with the Budget Committee around the state of Wisconsin. It's expected that the Joint Finance Committee will begin taking up items in the budget first week of May. So now is a good time to weigh in both on the proposals, some of the counter proposals, and really weigh in. I think just to remind folks, we have a 2-year budget that's supposed to go from July 1st of this year to June 30th of 2 years from now. So we operate on a 2-year budget. If the budget is not passed by June 30th, we just operate continuously off the existing budget. So we don't go through a breakdown like the federal government does, without it, but there are impacts for planning purposes, for school districts, for payments and other things. So you may have some direct feedback on proposals, that's great. You may have some feedback on issues that you're not sure are in the proposal, that's also great. You might have some feedback that we just need to hear on in general. So with that.
Yeah, basically what we want to hear is what your thoughts are on the budget, and even if it isn't in the budget, something that's passionate to you that you would like to have maybe included in the budget or just us to be aware of as well. The budget is a large document, spending a lot of money, so that's why we go around the area and hear from you. The Joint Finance Committee will wrap up its statewide hearings next week up in Green Bay, I do believe. And then they will start their deliberations, as Gordon had said. So we do ask that when you come up to speak, that you come up to this microphone so that the Oshkosh media can pick up on that sound as well. So with that, who wants to go first? Great, it was good to talk to you. So.
I'm sure we'd be willing to talk.
Come on up. If you could say your name and where you're from.
Hi, my name's Dave Merkley, and I'm actually, I work over at Bethel Home in Oshkosh. Mira Vita Living used to be Lutheran Homes of Oshkosh. Talking about long-term care, and I know that we, back in March, left some information for you, but I just want to reiterate some of the important things in that. Right now, our funding for long-term care for nursing homes is, we really appreciate what you did in last budget. It was amazing, all the help that you gave us. Want to continue on that path of what we were asking for. Right now, there's a tax on my private pay residents, people that come in and pay out of their pocket. They pay an extra $36,000 a year to stay at Bethel Home to pay for the residents that are on Medicaid because there's such a budget shortfall. So it works out to be about $80 a day that it's short. Our budget proposal that we gave to you guys asked for about an extra $25 a day per Medicaid resident. So we're not asking to get all the way to the end line, but we're asking for some relief. Okay. One of the things that you saw, you probably heard about just recently, is that there were 9 closures of nursing homes in the area.
Correct.
I had to take a call one morning of a person in tears saying that their dad was in a nursing home and she had a day to find a place for her dad and begging me if I could take him. Luckily, we were able to, but changing that from going from Neenah locally to now have to come down to Oshkosh, she said that it's going to limit her ability to visit her dad, especially during the winter coming over Butte-Mort Bridge. But it is critical that we get that funding and we ask for that. One of the other things too is the caregiver workforce crisis, and I know we've talked about it a lot. CNAs aren't going into the business because they can go to Quick Trip or go to festival and make just as much or if not more without the labor. One thing that I had maybe thought about might even work is even giving a tax credit for people that work as a CNA in nursing homes. Just give them a straight tax credit when they do their taxes. Something that helps them to get into this line of work. But again, we appreciate all that you guys do for us. You guys listened to us 2 years ago, and we thank you so much for it, and we just ask that you listen to us again on that. Just one other thing on the closings that I forgot to mention. This is so abnormal that nursing homes close. Usually you might have 1 or 2 nursing homes that close in a small area. They don't close in major metropolitan areas because some outside companies, some multi-state corporation will come in and buy these up. As I talked to my company from before that moved me out here, they said we're not touching Wisconsin because of the rates. And a lot of other places aren't looking to buy nursing homes here in Wisconsin because the Medicaid rates are just at that level. And that puts us at a disadvantage, our nursing homes and the people that are looking for it because it's affecting local communities like that. So anyway, again, thank you so much for your support 2 years ago, and we're looking forward again this year.
Okay, thank you for your comments. We did hear from people down in the Fond du Lac area about the support from 2 years ago. I understand that there's an issue out there, and you touched on the workforce. That is one of the priorities of my office is getting more people in the state to fill those jobs, and the CNA is something we really need to look at, how to get more people into that. So, thank you.
And the great news about this budget proposal is by taking the Medicaid expansion and investing $324 million of the savings right back into healthcare, we're able to draw back $1.6 billion in federal money, some of which goes directly to caregivers for you. So it's a great budget for you guys, and we just really need you to get out there and advocate for the Medicaid expansion. It's hard to have people ask for more money if they want to leave $324 million on the table. So we need to get you guys to keep pushing for that.
Who wants to go next? Come on up.
Can't miss this.
Thank you.
Nope, can't miss the folder.
It's the green one.
Absolutely not, that's right. I am Julie Mabry. I'm here from the Winnebago County Child Support Department. I'm the office supervisor for Winnebago County Child Support, and I just wanted to come and talk to you about some of the legislation that is currently happening and occurring. Specifically regarding the increase in our state funding, we've requested an additional $1.5 million for the whole state, as well as the proposed elimination of the birth cost recovery bill that was put into place recently, some administrative paternity, and if there's time, maybe incarcerated payer legislation that's going on as well. Basically, I really wanted to make it very clear, because I know at the Wisconsin Child Support Association meetings that I've been attending for the last 5 years, there is a concern that we want it to be clear to everyone that the increased request for funding of the $1.5 million along with the birth cost recovery are 2 completely separate entities and that they do not go hand in hand.
Okay.
And we just wanted to make sure that you were aware of that. And currently where we are at right now, it was put in the budget bill to eliminate birth cost recovery. And I wanted to basically ensure that I can inform you on exactly what that looks like for our budget for the state's specifically the child supports budget and also the Medicaid reimbursement budget and the effects on that would have. I wasn't sure on basically for charging a birthing cost for basically a father once paternity has been established. There are rules and regulations in place that say we are not allowed to charge more than 5% of 3 years gross income combined.
Okay.
And that typically that would not be more than $3,000 for the first child for the birth in a home, even if parties are intact, if it's an intact family. For Winnebago County directly, what that looks like is we take a look at parties as we're in court, and if someone is at a minimum wage paying job, we don't charge more than $1,591 for the cost of that birth cost recoveries. If they are above that, we're at $2,200. Anyone below minimum wage, we also do have our attorney take a look at that, and we will deviate downward as well.
Okay.
And I feel like that was maybe misinterpreted when you guys were given statistics by the ABC for Health that I think approached people when this all came in to play. It is also looked at for the birth cost recovery. We don't charge more than $25 per month to recover those fees, and there is no penalties, no late fees, no interest charges associated with any of them. And there is a state-owed debt is how that's looked at, so it's always the payer of last resort. So it is always the last item to be paid back after any current support, current arrears interest gets paid directly.
It's last hour.
Yep, gets paid directly to the custodian of the child. In doing some of my own actual numbers that I ran for you so that you have that, I looked at, and I have this on your second page for actual numbers, I looked at our district, which is 54, Representative District 54, and then I did the 3 neighboring districts, District 3, 53, and 59, and I believe Senate District 18 encompasses all or majority of them as well. Like you said, any birth cost recovery that we get back to the Child Support Agency, we keep 15% of that for the child support budget. That is matched by the federal government, $2 to every $1 that we receive back as well for our yearly budget purposes. And then 85% of those cost recovers goes to reimburse Medicaid and the Medicaid health program. So with looking at 4 districts, it would be eliminating $881,640 from child support budgets in our courthouses. And it would also eliminate $1,480 from the Medicaid reimbursement for that program as well, from just these 4 counties. That's not from the whole state, or just
Okay.
these 4 districts, excuse me.
And how, the districts, they're not by counties or anything, they're just
The
randomly
district
drawn?
the districts I looked at was our current District
Yep.
54 and then 3 neighboring
Okay.
districts. That's kind of what I just chose to go with. There is, I know a handout in here that looks at the entire state budget as well, and that does address that as well. I just thought, for our current district, that would be, helpful as well. Winnebago County alone, which is where I'm from directly, we would lose $176,337 in our county budget to us directly. Now, with the increase in, our caseload, our workload, Wisconsin has currently dropped from 2nd in the nation to 4th in the nation because we've been at a standstill for budget increase for over the last 11 years. And if we eliminate this money from birth cost recovery and then in addition do not succeed in getting the 1.5 million as well, I can only see that impacting that farther as well in our performance measures, which would allow us not to get child support orders established faster, essentially keeping money out of the homes of the children. In Wisconsin alone, I believe it said 60%, over 60% of poor families are on child support, 68%. And of that, 58% of that household income is made up of child support court orders of those low-income poverty homes. So by doing both of those things, it's going to become higher. Those numbers will become higher and they will become worse. And the administrative paternity program that we are putting in and we're asking for your support on as well. Right now, currently, if paternity is not established, we have to establish that via a court order. From the time that we get and receive notification of that until we can even schedule it for court is about a 3-month time period. And we're asking to do it administratively, so we wouldn't even need to get in the courtrooms. So that would essentially mean we could subpoena for DNA testing and have them come in and just be DNA tested instead of having to actually do it in front of a court. Leads to higher accurate results. And also by establishing it faster, now those men can also establish a relationship with their children faster as well. So we can get that ball rolling and facing the opioid epidemic that we are facing right now, too, we see a lot of children being removed from the homes.
Sure.
And because paternity is not established, it's a lot harder to get them to go with the fathers as well,
Okay.
versus having to be placed out of the home. So I guess to wrap it up for you guys in a nutshell, just to be clear that those are two completely separate entities, and we desperately need them both in order to continue running our program efficiently and accurately for our budget. And I guess one other thing that I did think of that I will toss in there for you is that child support budget doesn't only pay for the child support program, but we also help pay for a lot of the courts programs as well. We have cooperative agreements with the courts, and that we, because currently in Winnebago County are not on the tax levy, we're able to help fund those as well. And if we, are facing losing $175,000, we might not be in that same position for very long anymore.
Okay. That was a lot of information.
Sorry.
No, I mean, this is one of those issues that's received some attention, but
Yeah.
I don't think it's been walked through enough. Have there been any response from DHS or others related on the intent of the proposal? I mean, I think there's been some attention on the elimination of the birth cost recovery, but not on the specific funding or consequences with eliminating it?
I think you're absolutely right, and not a lot of attention has been. And I think the way it started was this ABC for Health company, which was a group of gentlemen that I think had to pay birth costs and were upset about that.
Okay.
And so then they started giving, I think, inaccurate statistics, and then the Wisconsin Child Support Association got wind of that, and it was almost already sort of too late. And now we're like, wait a minute, you guys should have some accurate statistics as well, and you should also know the effect this is having on us currently.
How is the birth cost recovery assessed? What is that charge exactly? The revenue generated?
So the revenue that we generate for that, every case we, charge our set amounts in Winnebago County on, and as those debts are paid off, it goes into all of those different banks and columns, and every year we can see how much is collected for each year. 15% of that stays, 85% goes back to the Medicaid program itself, and then we're federally matched by the federal government. And I will throw out there too, the federal match also does come along with the 1.5 million increase that we are requesting from the state. That would also draw down approximately another $3 million from the federal as well.
Okay.
Saw that.
Yeah.
Thank you.
Thank
Did
you.
you signed in with your stuff? You're from Winnebago County?
Winnebago County.
Okay, but you work in the association as your member?
Yes, I do attend as a member for the, I'm not an elected member, but I've been attending their quarterly meetings for the last 5 years, all over the state.
Okay. Thank you. It's not an issue I was really aware of a lot, so I knew it
Yes.
existed, but
Absolutely.
we'll definitely take a look at this.
Yes,
so.
please do, and feel free to contact me. I did list my email, and I believe I've emailed both of you previously
Sounds good.
as well.
Thank
Okay?
you.
Thank you so much. Take care.
My name is Kobe Skellinger. I live here in Oshkosh. Okay, so a couple weeks ago, or a week ago, I was at a meeting talking about health outcomes in Brown, Outagamie, Winnebago, and Fond du Lac counties. And the thing that struck me at this meeting was they had the average death age over the last 5 years for those four counties disaggregated by race. And so for all races listed, it was, what we would expect, like mid-70s or so. But for African-American people in those four counties, it was 30 years younger. It was 46. And I thought, yeah, I had the same kind of expression on my face, like, well, how did that number come from? And so I dug in a little bit and asked how they came up with it, and it was infant mortality was what was driving that down. So I wanted to encourage you, ask you to support, I think it's called the Healthy Babies, Healthy Women. I might have flipped that, but
That's what
those
it's
two
called.
things. I think it's $28 million. It does a lot of things that help correct that, the disparate outcomes in infant mortality. It would account for more money for doulas and other health treatments before birth and after birth that would just work to close some of those gaps. I also remember watching a city council meeting here a couple weeks ago, and the city had to refund, I don't know which business, but they had to refund a business about $20,000 or $30,000, I think, for their personal property tax. So I think in the last budget, maybe, this was taken out or something. I don't remember. I don't know exactly the details. You
I know
two
what
probably
you're
do.
talking
The conversation there was a lot about, what else was going to happen. I think Oshkosh has been a center point for several large businesses to ask for refunds and then have that sort of trickle around the state. I don't know, but the city manager and other people here were saying it could be pretty substantial. So hopefully you all can find a way to help the city and county get their, make sure that they have the funds they need to continue operating. And then lastly, I just wanted to make a plug because we've worked hard in our county to keep our jail population within the bounds of what our jail currently is. And as there's any changes to the correction, to the laws and the corrections that might shift folks from prison to jail, to think about the financial impact that might have on counties, both in terms of, if that's going to result in increased need for buildings, but also the ability to staff those jails.
Okay. One of the things you were talking about, the refund of the personal property tax, it's an issue that was brought to us by Mark Roloff and City Council, so it's something we're looking into to see what that is. The other one you talked about was dark store, and I think you were the sponsor of the bill in some way?
I'm a sponsor of the bill.
Yeah, so it's something I think is going to get resolved sooner than later, hopefully this session.
Yeah, there was a good article, I know, in the
bipartisan.
Oshkosh Herald, and I used it to bring it up with the League of Municipalities, but we did in the budget do a partial repeal of the personal property tax, which is not a great tax, but the concern for municipalities was losing revenue if the state didn't make it whole. And as I understand, part of the problem with this way the city did end up losing revenue and having to pay back was the way the it was not written the correct way, and DOR didn't, I don't know, however they filed for it, it didn't allow municipalities to be made whole. And then obviously the dark store issue, which I think a lot of folks have weighed in on, continues to be an issue where we're shifting revenue from national big box retailers that use services to residential and small business property taxpayers. So I will say on your first point, again, the money that is saved from the Medicaid expansion is reinvested into healthcare that allows for the expansion of funding aimed at addressing some of those horrendous infant mortality statistics, and allows for more home visits and supportive care. So appreciate it.
And on your last point about shifting people from the prisons when they're nearing the end of their sentence back to the county, there are some good programs in place, and most of those are contingent upon the sheriff's approval allowing it to happen. So if you don't have the room, he doesn't have to approve it.
Thank you.
So, thank you. Who wants to be next? Don't all speak at once. Come on up. I think the lady in the back was coming up first, so we'll let her go first. Hi there.
Hi. My name is Tina Hafman. I live at 1307 Washington in Oshkosh. I am a retired teacher, and so I currently volunteer at Levin, which is a limited emergency assistance organization in the Fox Cities. And so I've done that for several months now, and so every week or a couple times a week, 3 hours at a time, I talk to people who are in some sort of crisis, generally involving basic needs, money.
Okay.
So at Levin, about 65% of the people that come in, their crisis is on affordable housing. I know that lack of affordable housing is not really addressed in this budget things, but wait a second, I'm getting there. So about 65% of them have either can't make their rent or their mortgage payment, and another 20-some% can't make utilities. So it's all around housing. So then if you take a step back further and say how they got in that position, there's several ways, but one of the biggest ways is some sort of health care crisis. They either don't have any. Many people I interview, my job is to be intake, so I talk to them for about an hour about all of their finance situation. So I kind of get a good idea. I can kind of see some trends. It's been pretty eye-opening for me, as it would be for anybody. I see that children are on Badger Care, and then that the parents aren't. And the parents very often have nothing. So they've been gambling with the nothing, and then have a crisis and then have an ER visit or a surgery or something, and then they're so far in debt that they begin to give up. That's one case scenario. Another one is just a deductible that's high that they maybe can work on, but for that particular month, maybe something else happened and they've been pushed off the edge. So the Medicaid expansion is, I'm hoping that the lack of affordable housing will be addressed in years to come. I see that they are, we're talking more and more about precipitous housing, people who are unsure where the housing is going to be. That leads to all kinds of issues and problems in families, most often trauma in children, that then leads to issues of mental health, and it goes up the line. So I think that's coming, but for now, the healthcare, the Medicaid expansion is essential to families keeping it on an even keel and staying out of crisis, which is also traumatizing. Thanks.
Thank you. Affordable housing is one of those things that we're aware of. It is a problem out there. We got lots of good paying jobs, but sometimes they just need some affordable housing to get going. So it is something that a lot of players in the market are aware of. So, thank you. Hi there.
Hi. Paul Schmidt, Oshkosh. I'm not here to ask for any money. But I wanted to piggyback on the personal property taxes that are being eliminated. That was one of the items that I wanted to speak about. My question is there a formula? Is there something in the budget that is going to reimburse the municipalities for the loss of this revenue? The speculation is that if it's not, it's going to be attached to attached to real estate taxes. And you're talking about addressing affordable housing. There's an item that I think that should be looked at very seriously. Wisconsin Realtors Association is a good avenue for you to look at for affordable housing, as you probably know that. The other item that I wanted to mention, and I can't remember the acronym, school choice program.
Okay.
What is it?
I don't know if it has an acronym. Does it?
Yeah, it does. It's got all the initials. But anyway.
Everything in government has initials.
You know what I'm referring to.
Yep.
There's discussion about that. I think I'm hearing that the governor wants to freeze that amount. And I'm just wondering, again, if there's anything in the budget on it for this year other than the normal reimbursement. What is the forecast? What do you think the long-term future lies ahead for this program?
Okay.
That's all I got.
Okay. On the personal property tax, we are looking into it to see what got classified wrong. Because it was something
Machinery.
At DOR, something is being counted that we didn't think would be counted. So we're trying to figure that out. So if there's something we need to do in the budget to take care of it there. And then on the school choice, you are correct. Governor Evers put a freeze at the current level of where it's at right now. So that's what's in the budget, and that's a larger discussion that'll happen coming up here. So we'll see where it goes from there.
You put a freeze on it for
To basically to stop the growth of it.
So it doesn't impact anybody who's already enrolled in.
If you're enrolled in school choice, you're still in it.
Yeah.
It's a freeze for any additional growth from here on out in the program, or is it just in this budget cycle? Probably on out.
It probably needs to be acted on in 2 years.
But
So-
that's what his proposal is, and we'll see where it goes. I personally want to see the freeze lifted, but we'll see where that goes.
Both of your issues, Paul, and I appreciate it, have the potential to have a negative impact on property taxes in general. There's two issues. One on the personal property tax. Obviously, as we said, there was something that impacted the calculation that did not, the promise was municipalities will lose this revenue, the state will make you whole. That hasn't happened, but I did talk, because I think there is going to be a push to repeal the rest of the personal property tax, which would be a loss of about $200 million. But I understand that the fix, they would address the ambiguity on that. I think the concern is that maybe you do that for the next 2 years, but in 2 years, let's say we have a recession, is the state going to want to spend money on buying down or making communities whole? Or will that go away and then we'll just see a cost shift to property taxpayers? And on the second one, I mean, this is one where I think was a big mistake. I mean, the voucher program, when it expanded statewide in its first year, the state paid for it. But then they wanted to continue to expand the program and they didn't have the money. So right now, every year, it goes up 1% in terms of how many students they can have, and local property taxpayers are paying that money. And so we increase our levy to pay for students that are enrolled in private schools. In addition to that, the school district provides the transportation for the students to attend private schools. So when private school starts 3 weeks before Labor Day, it's all the public school paying just for those private school students. And I think this was a mistake to pit public schools versus private schools at the expense of property taxpayers. I think if they were going to expand it, they should have had it around the state, and maybe calling a timeout and having a freeze will allow us to have a better discussion about the long-term feasibility of having two publicly funded school systems.
Back to the personal property tax, I would love to see it all gone, because I think it's a tax that businesses are paying out there that nobody realizes they're paying, and they're paying a tax on something over and over and over again. So I think it's a tax that is long overdue to be gone, but I want to make sure that we get the first part of it taken care of before we go further and eliminate the rest of it. But I do want to see the rest of it eliminated. It's a matter of when we can do it.
Okay.
Thank you.
Thank you.
Thank you. And thank you for coming and having this hearing today.
Nope, thank you. Who's next? Come on down.
Well, my name is Steve Carlin, and I'm from here in Oshkosh. And I just was looking at the signs, and I just have two general questions I'll leave you with, if I could. The school budget increases are huge. And what I've been hearing is that the student population over time is trending down, the birth rates are down and all of that. So I would ask for the rationale behind a 13% spending increase on schools, plus allowing them to raise taxes for the schools when our student population is coming down. So a school's budget might actually go down, but they might have the same per capita or for their future operations. And secondly, to clear my mind, and maybe someone else could use this too, I know that Wisconsin did not join in some of the federal programs under Scott Walker for the Medicaid, and I'm thinking that's the term you're using, the Medicaid expansion. Correct. And can you run over that system? Because as I understand it, the initial impact of joining that system is a lot of money from the feds, but then in outgoing years, it leaves us with less funding or not the funding that we start off with, where if we get in the system to get the benefits, they don't continue in perpetuity or whenever the world changes. So if I could leave you with that, thank you.
Okay. On the education spending, like for example, K through 12, the state of Wisconsin in their budget of this last time around was approximately $76 billion. $14.2 billion of that went to K through 12 education. And the proposed number in the next budget is $16 billion. That's the proposed number. So it's what Governor Evers has proposed. A lot of that money goes into special education, which I think we will see an increase in. We're hearing from a lot of our superintendents out there, and I think that's one area that Democrats and Republicans can get together and agree on, that that's one area that needs to improve. The declining enrollments, yeah, it is a fact, but not every district is declining, so we got to look at each one individually, and each district needs to manage that level. I represent two of the bigger districts in the state, Fond du Lac and Oshkosh, so they're able to deal with the declining enrollment a lot easier than, let's say, in Oakfield, which I also represent, which has about 200 some kids in it. So if they lose 10%, that's huge. If Fond du Lac loses 20 kids or 50 kids, they can absorb that a lot more easily than a very, very small district. And there's a lot of Oakfields out there, and there's not a lot of Oshkoshes and Fond du Lac out there. When you get down to that 1,000 student level, there's a lot of people in the 1,000 to 1,500 student level. So they need to be aware of what their demographics are, because they know pretty much what their incoming kindergarten population will be 4 years out, or third grade will be 8 years out. So they can kind of look at that and see trends. So we need to plan accordingly. So, and on the Medicaid expansion, the one reason that Governor Walker didn't take it, and I also don't support it, is we're talking about dealing with about 88,000 families. And of that, right now, approximately 50,000 of those people on there, they have private health insurance through the exchanges at the national level. They're on private health insurance. If we took the Medicaid expansion, they would have to come off and go on to Medicaid. So that takes people off of private health insurance and puts them on Medicaid, which puts their reimbursements to hospitals and all those other institutions at a much lower rate as well. So, and I'm always worried about federal strings that are attached, and will that money be there in the future? Just this year, some people at the federal level were talking about cutting some funding to Medicaid. So I always worry about the federal strings that are attached.
Well, I'll say it's not a surprise that the former school superintendent, educator, superintendent, teacher made a significant investment in public education. It's probably one of the single most important, if not the single biggest investment, most important investment that state government can make. And it has to be for 14 years, not just 1 year. We can't go through the biggest cuts in state history and then boost funding 1 year when you enter in 4K and go through 12th grade. I think part of it also recognizes that we have a teacher shortage, and so the market is trending that we're going to have to pay more. But also the recognition that if you have 20 students instead of 25 students, you still need an educator, and that we have an increase in poverty, which requires additional resources, challenges, training, and there's some factors in the budget that increase the funding more for per student based on whether they qualify for free or reduced school lunch. Same with English as a second language. And on the special ed funding, it's really a formula distribution, recognizing that there are some students, and we value this, that we will provide the resources for, but it's that the state and federal government simply don't pay what the actual costs are. So districts have to divert more resources to fund those. By the state paying that portion, it'll be able to free resources up to be able to put into other classroom areas. Student enrollment, again, really depends on the district, and but we do know that if we're going to recruit people to live in this state, they're looking for good schools, and it's to get Wisconsin back on the radar. I know a lot of my friends that moved away moved home when they wanted to pick schools for their kids because of our quality education system, and falling out of the top rankings and spending is something that we need to catch up on. On Medicaid, I'll say this. 37 states have taken the Medicaid expansion, including Republican-led states in Michigan, Iowa, Indiana. Mike Pence, the vice president, took the Medicaid expansion. 90% of the money is paid for by the federal government. If 37 states' state budgets are built upon federal funding for that, the federal government is, that means that there are 74 U.S. senators who will never allow the federal government to cut the budget for those things, because those state budgets are directly reliant on that. So the reality is Wisconsin pays more to cover fewer people. And I agree that we need to make sure that the reimbursement that the state is paying, in other words, we pay too low right now, which is why the proposal increases that, and we're going to have to run the numbers on whether that covers the loss of private insurance pay. But we've gone, it's never too late to do the right thing. We've gone 8 years. We can provide better health care access. We can provide more resources to put into skilled medical care. And we can free up dollars to invest in education.
Come on. Heather.
So my name is Nikki Uharty. I'm from the Winnebago County Health Department. I'm also a member of the Wisconsin Public Health Association, which is a statewide professional organization made up of hundreds of public health professionals here in the state. So the materials I gave you are from that association. They talk about our legislative priorities for the 2019-2020 year, and also talk about Medicaid expansion, which we've been talking about quite a bit tonight. So I just want to hit on maybe a different part of the Medicaid expansion. So those dollars would allow the state to invest in a wide variety of initiatives, including the Healthy Women, Healthy Babies initiative, lead poisoning elimination, dental care, community benefit expansion, and tobacco cessation, which are all important social determinants of health. So research shows that in order to be healthy, we have to have good health care, but we also have to have the social determinants of health also, which are things like employment, education, housing, and a safe environment. And those things affect your health much more than health care. So clinical care typically affects your health about 20%, where the other social determinants of health and your environment affect your health 80%. So that's one of the reasons we support the Medicaid expansion. And it also gives us money to invest back into the initiative focused on prevention rather than spending all of that emergency money on treatment. So I hear what you're saying about the coverage with 50,000, 82,000 people, but it also provides funding for many other community health initiatives, not just expanding insurance for certain people. So we really think that we need to prioritize prevention to save money, but we need new revenue sources to be able to provide those prevention services.
Very
Thank
good.
you.
Thank you.
Thank you so much.
Who's next? Come on down. Hi there.
My name is Cheryl Hansen, and I live in Oshkosh, Wisconsin. I got your letter today about Medicare expansion. Now, I referred you in a postcard to the study done by the Milwaukee Journal-Sentinel. I hope you've had a chance to read it. I just want to point out that if we expanded Medicaid, yes, 39% would come from the uninsured and 37% would come off of Obamacare coverage right now. So yes, some of the people who would be eligible for the expansion would be coming off of the Affordable Care Act, where they are getting subsidized and still probably have trouble making ends meet. I do want to point out another article I read that says, studies show that expanding eligibility for Medicaid significantly improved hospital operating profit margins, according to an issue brief from the Kaiser Family Foundation, which does health policy research. Also, hospital associations have pushed to expand eligibility for Medicaid in states that didn't. And they presumably would take that position, would not take that position if they thought it would increase their costs and force them to raise their prices. So as you're looking at the budget, take a look at that, because I think overall, we'd be much better off with that expansion than we are right now. As an aside, I'm a retired addictions counselor, and I know that residential treatment is not covered by Badger Care if it's a freestanding treatment center. And unless that has changed recently, when I was taking phone calls a couple of years ago, I turned a whole lot of people away because Badger Care does not cover it. And considering the opioid crisis we have going on, I noticed that Ever's budget includes a suggestion of a program called Hub and Spoke, and I looked into that. Vermont has that program set up. It really sounds like an excellent way to address that issue in our state.
Thank you.
I'll just add, we've been going back and forth on this proposal for a while. I think Governor Walker was, opposed for a while, and some of it was because of its ties to the Affordable Care Act. But I remain hopeful, at least with members keeping an open mind. I've had some conversations with some of my colleagues on the other side. I do think there are a lot of opportunities to be creative. There are some pretty conservative states that put their blueprint on Medicaid expansion, incorporating some market principles, some things that I don't love, but I would accept if that's how we needed to get to yes. And so I do think there are some opportunity out there, making sure that we maintain keeping our hospitals whole. a lot of the things you said about health outcomes, and I'll look into the coverage for standalone treatment centers, because in states like Ohio, where Republican Governor John Kasich expanded it, a lot of it was for treatment of opioid abuse. They got some waivers from the federal government, and Medicaid is traditionally the largest provider for coverage for addiction treatment services. And given that, I think it's 16 to 35 above 100%. There's a large segment of a vulnerable population for opioids that would be covered under this. So,
I do know that Medicare covers a treatment program if they're attached to a hospital.
yeah.
Okay.
We have a lot of programs around the state that are not attached to hospitals,
Yep.
and as of a couple of years ago, they could not get
Okay.
reimbursed.
Okay. You know, the Medicaid expansion is one thing, a discussion that we're going to have as a larger caucus. We do talk, quite a bit to the other side, contrary to public belief. We get along.
I'm here today, even though I don't agree with these placards.
Those are just facts, or what's in the budget, but we do get along. Gordon and I, we talk all the time, and we don't always talk about family and all that stuff. So, it's a cordial relationship down there. One thing you probably didn't see in the news is last Tuesday we were on the floor. All the bills that got passed and resolutions that got passed were all bipartisan. I'm sure you saw that in the headline, right? And so there are some good stuff that gets done in Madison. About 90% of what we do is bipartisan. But no, those are bigger discussions that we'll have as a caucus, and we'll see where it goes from there. And, the opioid thing is something that we need to really be aware of. It's something we've done a lot on, but it's still continuing. So we always got to be looking at things. So we'll take a look at that as well. Come on.
Well, speaking of bipartisanship, I know you both love libraries. So I'm Desiree Bongers, Oshkosh resident and director at the Ripon Public Library.
I am Mark Arend, also Oshkosh resident, and I'm with Winnefox Library System, which covers our 5-county area with 30 libraries.
So I just wanted to talk today a little bit about libraries and how important they are to the communities, and mention that they're a good community partner. As a resident with my family and kids, we've been to Oshkosh Library activities at the Payne, at the Downtown Y, at the Masonic Temple, at the Farmers Market. So Gordon mentioned quality of life, and I feel that libraries are very important for that. And then, as a director in Ripon, just a week ago I heard from a new patron who told me that she moved to Ripon specifically because of the library. That was the deciding factor between moving to Beaver Dam
must have felt
with
good.
her family.
That must have felt good.
Yes, it did.
Yeah.
I said, please email council and tell them this. So I was very happy to hear it, and she's jumped right in. She's joined our friends group already. She volunteered for several hours for the book sale this last weekend. So it does make, libraries do make a difference in the community, and they attract families to move to the community. So thank you for your support in the last budget, and I hope you'll consider supporting our request for an increase in this budget.
Well, libraries do make a difference in our communities, and as a focus of workforce development is people look at where they want to live by the quality of life, and that's a part of it. Libraries have changed a lot since my kids were little and decide, should we go to the library today or not? Oh my God, they've changed a ton. So changed a lot since I've been there as a kid. But it is a quality of life issue, and it's something that we need to make sure we take care of.
Yes, thank you. Yeah, your support, we could really use that. I work with a lot of libraries in very small rural communities, and I see the importance of the library in that community to the people that live there. You live in Oshkosh, there's all kinds of opportunities for getting information, but you go to the small towns, there just isn't. And some places the library is the only place that has high-speed internet that people can get to. And there's more and more things, government things, employers, everything they do is online now. So, and one of the things we do in Winnefox is we provide that network for high-speed internet for our libraries. So they don't have to try to figure it out themselves. We take care of it. So I'll just thank you again and hope you support the library funding in the governor's proposal.
Thank you.
My name is Craig Whitney from Oshkosh, and I was wondering if you would explain Motion 99 and how it works, and is there anything being done to eliminate it from showing up in the budget process?
About the 999?
999, okay. Yeah.
As a former member
Yeah.
of Joint Finance,
I
I
know.
will let him handle that
Okay.
first.
So I think as long as I've been in office, and I served on the Joint Finance Committee, which is made up of 8 senators and 8 state representatives in the Assembly, bipartisan, so the majority party will have 6 of the 8, and the minority party will have 2. So it's 12-4 if you were going to look on partisan lines. After you go, what happens is, let's say we take up K-12 education, and we'll get budget papers to read, and it'll say, here's what we do now, here's what the governor is proposing, here are some other things that you might consider, and you can also come up with your own things. And we'll go item by item through the budget. It's a fascinating way to learn about things. But at the, what Craig's referring to is at the end of every budget, there's usually something called the 999 motion. And most of the issues in the budget have had an opportunity like this and other things to be discussed. It has been habit. It's happened with both parties, both sides in control, where there's some new additions to the budget or some last minute things and that are added. If you remember a few years ago in 2015, there was a motion that out of nowhere dramatically changed open records policy in the state, and the public outraged, and it was changed back before the budget was passed. But I think, I forget what was in last year, but it's always, sometimes it's issues that somebody wants, and again, budgets are complicated. You're usually voting for some things you like, some things you don't like, and a lot of the things that get inserted into the budget don't receive a public hearing, may be poorly written, may have unintended consequences. But I think, Craig, you're speaking out just because it's not exactly a part of being transparent, and accountable, and if it's a good idea, it should stand alone on its own. So I think it's increasingly gotten more attention. I mean, I think 4 or 5 years ago, I never heard the public talking about getting rid of 999 motions. So I think it speaks to the fact that the press is, what's left of the press is focused on it. And, I can certainly share, your input on it. But
And the legislators, they don't have to identify themselves either. They put
so when motions come forward, and again, if you're in the minority party, it's even worse because you get handed 50 pages maybe of 30 different ideas, some small, some technical fixes. Yes, and you don't know who put forward the motion unless there's like an open records request and you see maybe perhaps who had a drafter do it. But, I know there's a lot of support by my colleagues for the manufacturer and agriculture credit, but that was something that was dropped into a 999 motion in 2011, and that was supposed to cost $128 million a year. Now it costs more than $300 million a year. So if it had had a public hearing, I think we would have been able to understand exactly a little bit more what we're doing. So it's not good government, and I think there's an attempt to try to minimize it, but you're going to always have people that feel like they're trying to push forward something that there's certainly an audience for, but it's not transparent or accountable.
Was it more minimized since 2015, since that?
I feel like last
Because
year.
I feel like last year was my first budget process, and I had really never heard of the 999 till the 2015 thing, and I considered myself paying attention, and that was the first time I really heard of it. And so last year, my first time part of the process, I thought it was pretty small, considering
I think so.
what it was.
I mean, nothing stands out. 2015 was a big one, but I'm sure there were, and even if the things were more innocuous, like it's understandable that at the end of the budget process, you might have some technical fixes or some cleanup where things maybe weren't written, but there's a lot of groups out there, a lot of lobbyists out there, that won't give up on their issue or tweak or change, and if they can find a way to get it in there. And I think the thing that I found most challenging is that I didn't have time with the proposal before me to figure out if it was good or bad because I didn't know. Meaning we were voting on things in pretty short order without having an idea, asking local government or the school district or whatever industries impacted. So I really appreciate that. I think there is more scrutiny. And I think if we can encourage them, I think we will. I think we'll have to see. Hopefully, if they're going to do things, they certainly can push them in other parts of the budget.
Thank you.
My name is Sharon Kerner. I live in Oshkosh. I don't represent any group, and I don't have any requests for money, but I would like to know what the budget is going to provide for the DNR to be improved so that we can care about chronic wasting disease and keep our resources as good as they used to be in the past. So I'm wondering what the budget provides this year for that.
I don't specifically know about chronic wasting disease. It's something I can look into, and we can get back to you on that. I know it's something the DNR is very aware of and working on, but if there's anything specifically in this budget, there is not, I'm being told, so.
Is there anything for the DNR to improve the permit situation? Because I've heard sometimes there's problems getting the accurate permits and.
What kind of permits are we talking
Well, the
about?
wetlands preservation
Okay.
and things like that. So I'm concerned about Foxconn and everything. I sit home now that I'm retired and I'm thinking this is a beautiful state.
Sure.
And I don't want to see it destroyed. So.
No, it is a beautiful state, you are correct. I've never heard anyone say, hey, I want some dirty water. We all want clean water, we all want clean air, so we want to be responsible at the end of the day, and I think the DNR wants to be responsible, and business owners want to be responsible out there as well. Do accidents happen? Yes, but we got to make sure we take care of those right away and deal with those appropriately.
Okay, I count on you to do that. And you
I'll
too.
just say that there isn't anything specific on CWD, and part of the explanation was they didn't want to be reactive. We've known about this issue for a while, and I think it's, there are some steps that we're going to need to take, but instead of kind of rushing it into a budget proposal, it's not that they're going to study to punt on the issue, but they didn't want to just put something out there. There is funding, and part of it is created by, they increased the fee on the big factory farms, the CAFOs, not a ton, but the revenue generated from those is to pay for more science positions that were eliminated in terms of the science research positions that were eliminated a few years ago in the budget.
Okay.
So there is going to be a priority of putting sort of the research and science back into the DNR. There's obviously an emphasis on water quality, which is getting a lot of attention from the legislature, whether it's lead pipes, groundwater contamination, ground quantity with the high-capacity well issue. It seems to have reached the public's attention, and I think there's a wholehearted effort to do that in the budget. There's some funding, at least on the lead pipe issue.
I used to hunt, but I don't want to hunt now. I'm afraid if I get a deer ever, that there's not a testing station in every county, and I would hope that someday that will happen, because I feel for the hunters real badly that are out there already. So thank you for your time.
Thank you. Anybody else?
My name is John Fitzsimmons. I live Algoma Boulevard up by the cemetery. I came here to listen because it's a listening session, but I wanted to make a comment. Some of the things I heard about, there's two things that kind of get my dander up when I hear them said. When we talk about Medicaid and insurance and doctor bills and all that kind of stuff, number one, we talk about federal reimbursement. Let's call it what it really is. It's federal tax money that I paid in that's coming back to the state. So, that really, if we want to, let's be clear about where that money's coming from. It's not this golden pot of, imagined.
There's no magic money tree.
No magic money tree that this is coming out of. It's still coming out of our
Right.
taxpayers.
Now we're just giving it away to other states.
Right. But I'm just saying, let's fix that problem. Let's talk about that as an issue. Why are we giving the money to the
let's bring it home.
Federal, so that they can then dole it back to us, as they see fit? That to me just seems kind of counterproductive and maybe unconstitutional. I don't know. But the other thing, when we talk about healthcare costs, and I know from personal experience, that the costs of healthcare are outrageous. And to me, that's the problem. And you know, when I see hospitals, here in Oshkosh, we have 2 state-of-the-art hospitals. Not to mention how many walk-in clinics. And now I can go into Walmart, I can go into Shopko, I can go any place and get my blood pressure and get all this medical, you know, treatment, not treatment, but, you know, I can get checkups. How is it that these hospitals and these doctors can keep charging more and more and more, and yet I can't even tell when I get the bill what in the world they were charging me for, because it's in some kind of Greek or it's in Latin. I'm not even sure what it is they're charging me for. How can we make the hospitals and the doctors accountable? Like every other business that I go to, I say, give me a quote before I go in, or even let's say after I go in, they say, hey, your card came in for this, but we had to do this and this and this, and here was the cost, here was the labor, here was the parts. That is not the way it works with the hospitals and the doctors. They give us, you know, all this list of stuff that they did. I don't know what it was. So if you can address that, I would really appreciate it.
I am looking into some options on the healthcare front of kind of it's called Right to Shop, where you can look around and if you can save money for your health insurance company, you actually save money yourself. So that's one option. They do it in one state. I think it's Connecticut out east. Don't quote me on that, but I think it's one of those out east where I was at a conference and they talked about that. I was really intrigued by it. So, because one thing we've never done in this country is work on making healthcare more affordable. And I think we really need to look at how can we make it more affordable. It's very accessible. Like you said, you can walk in a number of places, get a simple check, and if you're really injured, you got 2 hospitals that you can walk into as well. So, I mean, the accessibility part we got down pat. Now we need to work on making it more affordable. And I do look out my window at the Capitol quite often for that money tree. It's not there. So, a lot of trees, a lot of beautiful trees, but no money tree.
It's going to be hard for Dan and I to fix healthcare this afternoon, or with you.
We're going to need tomorrow.
I mean, I'll just say this, and we have to, I mean, Medicaid is a state federal program, as you mentioned, and we're certainly a partner. States are a partner. In fact, we've been pretty innovative since Governor Thompson created Badger Care, and we've utilized the state-federal relationship to provide pretty innovative programs. That being said, in this country, we decided we're going to have a for-profit healthcare system where insurance company executives are going to make billions of dollars, where hospitals are going to make a tremendous amount of money. If you talk to doctors, they're being asked to spend an average of 11 minutes or something per patient. They get paid based on fee-for-service. We're the only country in the modern world that does that and is about making as much money as possible, which isn't going to lead to great health outcomes. I'm not saying, that we go, totally the other way, but there are consequences for a system when denial of coverage was aimed at saving money. We've addressed some of that with covering pre-existing conditions in the Affordable Care Act, but we've seen some increases as a result. One of the things that we did do as part of the Affordable Care Act waiver is the state is doing a reinsurance program because there's a few people that are usually responsible for some massive outlier healthcare costs, and by the state doing a reinsurance program on those, it should be able to flatten a lot of the other premiums out there. So we use the tools that are available to us, but again, the incentives in our healthcare system are primarily to make as much money as possible. And as long as that is ahead of patient care, it's hard to see us, given how much we pay versus the rest of the world, reining that in. And it only seems to get worse.
Well, the time of 5:35 has come, so I want to thank everyone for coming out. Please make sure you sign in so we can get the contact information for you. If you want to reach out to us at any time, please do. That's why we're there. If you got any issues with any state government on anything, budget or non-budget related, reach out to us, please. Thank you for your time, and we'll probably stick around a couple more minutes. So, thank you.
Thank you.